Finding the Voices.
Talk show by Monica Igudam.
I'm a huge fan of Finding the Voices.
You're doing a great job for Manipur.
Manipur bu prithivida masatak pa
good positive voices and make those voices more visible.
We wanted our voice to reach in all the corners of the world.
Interesting people.
Been finding voices on
people from our own place.
Share positive stories and inspiring stories and bring out the good stories of Manipur.
Finding the Voices.
Is there any other thing you want to share before we move into the palliative initiative?
Yeah, I would like to share more about palliative care. I think that's what I'd like to speak about.
Yeah, I'm looking forward to hearing
it's my passion
that.
And then I want other people to know about palliative care. Palliative care was not known to me till 2014.
Oh, so it's very recent.
It's a very recent thing for me personally. Although I have heard of the word and we know what it was, palliative care, what palliative care was in a very brief nutshell type of knowledge.
Right.
And not much practicing it actually. But once I came to know about it, then I saw a huge area of healthcare that was necessary and which was definitely required, and nothing was being done. So actually it's all about IT and how IT has helped develop this phenomenon here in Manipur. We in our batch, in MBBS batch, we created a Facebook group and page of our batch, and we were adding our friends one by one into this Facebook page.
Okay.
That was sometime in 2013,
your MBBS college.
14, yeah, MBBS
batch.
college, the batch where we all joined together on the same day. So we made a Facebook page. We were the 24th batch, so it was the 24th batch Calicut Medical College. That was the group, and we were adding and we were finding out our friends which we had lost contact for the last more than 20 years, 20-25 years we have not lost contact. So and we were rediscovering ourselves and reuniting and finding out who is who and what is what, who is where and what they are doing. And Facebook was helping us. And then I found out that one friend who had joined together, we had joined together. After MBBS, he went on to do anesthesia post-graduation, and then we lost contact after. I was on my track to come back here, then go back, complete my surgery, come back here and work, and then be in Shija hospitals all this time. And Facebook came, I learned that he is doing work in palliative care.
Okay, so that's where you got introduced and pulled in.
Yeah, so I simply on Facebook discussion, what are you doing in palliative care? And as we were tracing, and he was posting pictures of one night he would be in Odisha, the other day he would be in Malaysia, the third day he would be in Sri Lanka. And why you are traveling all these places? So he told me that this is palliative care and I'm going for training people for palliative care. So just on the spur I invited him to Manipur. I said, you have never come to Manipur, and we were classmates, why don't you come? Then very hurriedly he replied and said, yes, I'll come, I agree. So sometime in June of 2014, he came. We were 3 of us from here who studied in Calicut Medical College in the same batch from Manipur.
Okay.
So the three of us and this doctor, his name is Suresh Kumar. He came and we arranged a one-day awareness talk in this same very hall here. And we discussed, he told us about what is palliative care. And once he spoke about palliative care, then I understood that this is something we really have to work for. And from then on, he has come on so many times to train our doctors and nurses in palliative care, and then we then formed an association, and with the association we have moved on to work for palliative care. When a patient gets ill and sick, there are two ways to go. Either he or she is ill from an acute illness, where a particular treatment or a surgery will cure the patient completely, and the person will go back to normal life as before, without any hindrance. That is acute illness. And the other one is a chronic illness, where the person suffers from an illness which cannot be totally cured, goes on as the life goes, and he or she is under control, but not cured. That is chronic illness. And there comes a stage where the chronic illness becomes incurable or uncontrollable, and nothing much more can be done. At that time, the patient and the relatives have many issues. They have, particularly the patient has physical problems. It could be anything.
Like
pain.
they are not able to take care of themselves.
Not exactly. He will be suffering so many things. Like he's not able to swallow. It could be simply cancer of the esophagus. He has been on treatment for long with radiotherapy, surgery, and all that, and he has difficulty to swallow. Just that. He has difficulty to swallow. That is itself, giving him a life which is not worth living. That would be his feeling like that. So, or pain, simply pain, uncontrollable pain. Although the illness cannot be cured or removed from that person, but suffering from pain. So those are the physical things that the patient can have. Mental problems, psychological problems with depression, emotional breakdown, so many issues there. Social problems, if the patient is suffering from end-stage HIV and AIDS, and if that has not been taken care of in that particular society, you'll have social problems there. Even TB, if a patient suffers, even now, if a patient suffers from TB, doesn't want to let other people know.
Yeah, that social
they want to
taboo
hide it.
is
Yes,
there.
exactly. So those issues are there. Economical problem, definitely, because they would have had spent so much money to treat their illness, chronic illness, especially places like Manipur where there's no insurance backup. We were discussing insurance. There's no insurance backup. Sometimes, or the majority of the population who are not in the government service.
Right.
So economic issues will be there. There will be spiritual issues as well. As the person is nearing death, they'll start thinking, who am I, where did I come from, what is religion, who is God. These things come creeping into the mind very often. Also many issues develop with these chronic illnesses progressing. And towards the end of life, they come to a situation where they don't die. They are suffering from illness. But the doctors can't do much. The society can't do much. They keep suffering. Most of the illness in that situation, the hospital, the doctors say, we have nothing much to offer, you can take the patient home. Patient is taken home, and then what?
Right.
The family does not know what to do. Patient does not know how to cope up with it. He has not only issues about himself, but his family and other things. There are issues of telling the story and not telling the story, letting him know that he is suffering from cancer or not. He is trying to hide things from the family. Family is trying to hide things from him. So many issues that happen in that particular point of time in that person's life. So here palliative care comes in.
Okay.
Palliative care is total care of the patient to take care of his physical illness, his psychological issues, his social problems, his economical status, and also spiritually. And this is given to a person who has reached a stage of illness which is incurable until the patient dies. To give him support mentally, to give him support physically as well, to treat, if he has pain, we can give medicines so that at least he doesn't have pain. So that can be done. And that is what is palliative care. And as we were learning during our medical school, we thought palliative care has to do mostly for cancer patients.
Okay.
But once I came to know in more detail from Dr. Suresh Kumar, it's not only about palliative cancer patients. It's the entire gamut of illness which a person can suffer from. Anything, it can be anything. And everybody needs palliative care. Need for palliative care, necessity is so much that although everyone wants to die suddenly without having suffered, and then without giving trouble to others, relatives and people nearby, everybody, if we ask, they want to pass off without having all those difficulties. But the statistics says that more than 85% are going to have chronic illness with a time, coming to a time when it will not be curable or it cannot be controlled, and will be suffering and then passing off. So actually this story dates back to around 1967 when one nurse, Cicely Saunders, she took up this challenge and she started taking care of end of life care, just approaching death. So she set up a hospice center in UK, and that is the first hospice is St. Christopher's Hospice in London. And with her philosophy, it progressed well, and people liked it and multiplied. Many centers came up in Europe, and in US now particularly is more than 1,000 centers are there, hospice centers, to take care of end of life care. And it is a very huge field and department
by itself.
By itself.
Yes.
End of life care. So that is there. But the issue was that it is costly, and it is not covered by insurance. Even in US,
yes, it is not.
It is not covered by insurance, and the patient or the person who is going to die has to shell out everything, whatever he has earned the entire life, so that at the end of life, in those few months or few days before that, going to the hospice and staying there. It's a huge social problem actually, and the number is only increasing because the life expectancy is increasing. As and when we are controlling the acute illnesses, but people are living longer.
It is expensive, but I think at least the facility is there.
It is there.
So
in the US, yes, it is there, and they have a system.
They have a system.
It is being followed, and there is palliative care over there in the true sense. But that has not happened in the entire world. Although many countries have taken up hospice care, and even Singapore, China, Japan, Korea, they have. But in Kerala, in the same medical college that I studied, anesthetist, one doctor, he started pain clinic, and then he went on to learn about palliative care in England, came back and he started palliative care in Kerala. And although home visit and home care, palliative care is there in the rest of the world, the model that was set up in Kerala was different, in the sense that they involved volunteers who are student volunteers, to take part in palliative care. And once it was successful, it's almost 24 years now in Kerala that has happened, and they have progressed well, and the entire Kerala state is now they have the facilities for palliative care, and more than 1,000 units are there taking care of palliative care, and most of these are modeled on the one that was started in Calicut Medical College. There's an Institute of Palliative Medicine over there. They modeled it according to that model, and that is home visit based palliative care.
Okay.
And it was to the liking of the society as well as the people and the patient, because most of the patients, they don't want to go and die in a hospice or a hospital with so many tubes and so many catheters and tubes all over. They want to die in their own environment, at home environment, and targeting that, the Calicut model, they started visiting home on a regular basis until the patient dies, and that has worked well. So hearing these stories, I thought we need it in Manipur.
Right.
And in fact, WHO in 2013, they have said that palliative care is a necessary health care, and it should be available in all the peripheral health centers across the world. India's they have their program is there in their National Health Mission since 2014, but practically nothing much has been done in the entire.
Means it is recognized, it's acknowledged that yes, we need this, but
we
it's not
necessities there, but work has not started.
It has not started.
It is only in Kerala which has done real good work on that.
Okay.
And now the Kerala model is being copied and being practiced in other parts of the country as well as other parts of the world as well. So that is where Dr. Suresh Kumar, who was one of the pioneers to start up this in Kerala, he was moving around the world
trying to spread that
and training other people.
Right.
So he came here and trained us as well.
So how is it?
That was why he was moving around. On the Facebook, when I was following him, he was moving around so that he was training other people in other parts of the country. So once we did that, we had ourselves trained here, and then 2015 last year, in May, I myself went there and spent 10 days over there in palliative care and studied how the system worked over there.
Okay.
We also formed an association here in April of 2015.
Okay.
That is the Palliative Care Society Imphal. We have many doctors from Shija hospitals, from other hospitals, and other doctors in the state government, and we have other nurses and from other institutes as well. We formed this society, and we have progressed from then. And we have chosen this Thangwaiband area for our initial pilot project.
Okay.
And on the 2nd of August 2015, we started our first home visit palliative care.
Okay.
Our team of doctors, nurses, and student volunteers, we went and started this. When ILP was at its maximum, on 2nd of August, the ILP was at its maximum, but we thought we should not delay it because of its necessity. We started, and we have continued till date. We have continued non-stop going to these houses and taking care of these patients. So in Thangwaiband itself, we had registered 16 patients, and we assure them at least once a month visit, and the entire program is free of cost to them.
Okay. So what if like people beyond Thangwaiband, like other places, want to sign in? Is there
this is the exact question I want people to ask me, so that I can tell what we are thinking and planning. As and when we give this awareness to people, everybody thinks that it is required, it is necessary. And once we have started this home visits in Thangwaiband, we have realized that it has done very much good to the patients who we are going, to the family that we are going. It has done a lot of good to them. But the best part is it has done good to us and to the volunteers. I'll tell you.
Monica Finding the Voices.
Finding the Voices.
Finding the Voice.
I could see my father. Who came to meet my headmaster because he was unable to pay the fee. I'm sorry.
Because we need such story for people to have faith in the government and the system that yes, it's working.
Let's bring peace in our home state, Manipur.
Who have got the job without bribery, they will do justice to their job and they will help raise the standard of Manipur.
Me machine kre do ai adu paraga tingogi
nè hai đi hai đi và con
shortly about what has happened to the volunteers as well. But so we think that it should be available to the entire state. This facility and this home care visits should be available to the entire state. But for that we need manpower.
Right.
We need a lot of people to be involved. And it is a voluntary service as of now. At one time, if the time comes, the situation develops, it may become a separate entity as such, that it can generate workers, I mean with salary. Salaried people may work for this field. Time may come. Kerala has that. They have salaried people who are in palliative care and the entire departments are there for that. That is different. But as of now it is a voluntary service and we are taking out time from our own services. So we need more volunteers, more people to get involved. When we have started palliative care, we have pledged that we will be doing this until the patient dies on a regular basis or until the patient and family refuses our services. Once they register, we will be going continuously until, so I can't predict when a patient is going to die, but we have to regularly go there and take care of
whatever is the situation.
Whatever this.
Yes.
So if I am to do that for the entire state or leave alone entire state, entire Imphal itself, I won't have time to do anything else. Therefore, I need many other people to get involved, to take responsibility of small pockets. So people in Sorokhabam take care of their patients. People in Uripok take care of their patients. So doctors should be involved, nurses should be involved, students should be involved, other volunteers should be involved, other people should be involved. They should get it. So now we are targeting doctors and nurses from Thangmaiban to join us, and then we will be going along with them. They will be following us, and then even very recently, 2 days ago, we had a meeting, and we talked to the people of Thangmaiban and some nurses and doctors. They are interested to get involved. So we'll be involving them. Once they follow those patients, regular patients, they start following them and they are able to take care of them in the palliative care, basics of palliative care. Then we will shift to another area.
Okay.
And train other people over there. Again, we'll shift to another area. This is the initial plan, what we have. But once the benefit of this is understood by people, and when we want to implement it in large numbers all across the state, then we will have to set up a training center to train these people as we had trained here. It's a 3-day basic training course where principles of palliative care, and principles of basic nursing care, and principles of communication skills.
Right.
And these things are taught within those 3 days. So all that training has to develop in large numbers. So we had to set up a training center, and that is our target again.
Okay.
To set up a training center so that so that it can move forward in a larger number and speed up our desire, our intention to spread it to the entire area. We can speed it up.
Right.
So that is the way we are looking forward to go about.
No, I mean, I'm very happy to hear the initiative, and like you said, people are not aware, and the need for taking people's experience and voice for such care and let everybody know.
Yes.
That's one thing. The other thing is volunteering. Again, like the concept of volunteering in Manipur is very low.
Exactly.
And when I went to US, I was so amazed that many of the things are run just by volunteers. And I think it's just not the work which they are doing, but it also shapes the personality of the young people who volunteers. In this case, like, you know, they could develop empathy and sympathy, and, you know, like there would be a lot of human development, and I think that's what is lacking in our society.
Exactly. I'll tell you the story about how the volunteers have shaped with this palliative care. So we had called some students, and college students and school students and nursing students for our first awareness campaign on palliative care to the students. From then, a few of them, they joined us, and then almost on a regular basis on all our activities they have been together with us. And they themselves feel the change in their own personality, and the family members and their relatives and parents feel the change in them, and they are so happy about it. These children, for the first time, were seeing patients in that situation.
Right.
Otherwise, they were not knowing that human beings can suffer such. For instance, I took took some of them to a quadriplegic patient who had a young boy who broke his neck in an accident and cannot move any of his limbs, and he has no sensation below his chest. I took them to this person once, and the very moment we came out from his house, some of the student volunteers, one of them commented that from today I am changed. That was the first thing he said. From today I am changed. Because he could never imagine a person in that state, lying on the bed, immobile, for so many months, like that. That can happen to any of them. That was a realization for him.
Right.
And once we started going on regular visits and talking about patients and their situations, the students and children, they began to realize that their own expenses that they were having was so many times they were spending on very frivolous things, unnecessary things. One student volunteer, he was saying that he used to never cut his hair other than parlors, which was much costlier. But now he agrees to go to anywhere, any barber and get it cut, because he thinks that now he will be able to save some money. Because he realizes that value of that money, which could, very little, but which could give a lot of relief to a patient who is suffering from pain. Morphine costs about 30 paise per tablet of 10 milligrams. In one day, one tablet morphine 3 times a day can relieve the pain totally. Most of the pain can be relieved completely. 1 rupee per day, that means 30 rupees per month. A patient suffering from intractable pain can remain painless by taking morphine 10 milligram 3 times daily for a month. He will have no pain. That can be done. The cost is 1 rupee per day. That means 30 rupees. 30 rupees is all that is required to remain pain-free from severe pain. The students, when they learn about this and
so
when they see the real practical things with the patient, then they realize my 30 rupees which I spent for so many things unnecessarily can save the patient from pain for 1 month.
1 month, yeah.
And for 1 year, then they calculate the money, then they realize how much they are unnecessarily wasting. So he was saying, I used to wear only branded clothes. And my parents, they were affording all those things, so I used to do that. But now I'm taking care that I can save. He himself is getting some scholarship from the government for his studies. Earlier, that was not enough.
So now he could manage with that.
Now it is, he's having access, even when he is spending from his pocket to do this volunteer work. The expenses for his travel, for volunteer work and all these things. And so he has got now excess money. Instead of taking money from his family, he is now able to save money from his scholarship. This is only one story.
Right.
There are so many other stories like this. Seeing this, the parents, some of the parents, they have called me and said, you involve them in palliative care. And there's a very good change in them.
Right.
And we want this to improve. So they very happily allow them to come in palliative care. And when they move in palliative care, they see real life situations and they feel for the people. And once they see that, then they remember their own home and the situation there. Oh, I have also a grandmother who is suffering from something. Before that, they were not realizing. They used to come out of their house early morning for tuition, go back at night, not even meeting their grandparents.
So this
now this has changed them. They are able to talk to their own relatives now.
Right. So the initiative is not only helping the patient, but also the people who are helping.
Yes, the self. It comes back to the self. Yeah.
And overall, like, it is going to shape the society too.
Exactly.
So if anybody, I think this is more for our listeners who want to sign up for the volunteers, what is the process? Can they sign up over the Facebook page?
Definitely.
I think that's the page which I have seen.
Yes, it is available on Facebook. Palliative Care Society Imphal, and anybody can join us. There's no restriction. And lot many more benefits. For example, we have special classes on communication skills.
Right.
So the child learns to communicate with people with feeling and with truthfulness, because here is a situation where a patient is going to die in a few days or few months, and they're taking care of. When they go near these patients, they cannot talk anything other than truth. They cannot show pretense, and the skill develops in them. And if it continues, then that will continue in their everyday life as well. To talk truthfully, to be sincere.
Right. So a lot of values are being taught in this process.
Exactly.
So how many people are being pledged, like when you take a patient in to look after, till the end, like how many people generally, you said you visit once a month.
Yes.
So if the requirement is more, then what happens?
We are now about 100 of us who are trained, certified, trained for palliative care.
Okay.
That includes the nurses and doctors and some students. So, but that is not enough. We need a lot more. And this we can continue. For this, at least for these patients that we have already registered, we can definitely continue with all of us together. We can manage. But 16 is not only the number in Thangmeiban, because many have not registered yet, because many have not heard about it.
Right.
Even in Thangmeiban area, although we try to contact all the club leaders and inform them and to register their names to us, but still people are not aware what exactly palliative care is about.
Is it the awareness only, or is there a resistance because they don't want people to know? Do we have that in our
I wouldn't say resistance as such, but misconceptions.
Okay.
But because the general feeling when they say that some healthcare is coming, they want everything free.
Okay.
For instance, medicines they want. So when we go and take care of these palliative care patients. Some of them don't need any medicines. They need only care.
Okay. But they expect that whatever the other conditions were there before, the medicines what they used to take, they expect that you provide it.
And as of now, we don't have any fund.
Right, because this is all voluntary.
All voluntary, and we are just about beginning. Of course, in Kerala, the entire system is backed by students, and the students raise a lot of funds, all different ways, techniques. Our students have gone there and trained from there and learned from the students over there how they raise funds. They have started their palliative care awareness from class 8 onwards, and there is a government policy of palliative care in their healthcare system in Kerala. We don't have any of those things, and their students in colleges are posted in palliative care for 6 weeks in their curriculum. So it has gone into the education system as well.
Right.
So awareness is extreme over there, and there's no hindrance in raising the funds in a large scale.
Right, and even I think the concept of salaried worker, it's great because in our society we need it. Like, you know, for a patient, if there is a need, but we don't have the help or expertise. So I think definitely right now, even though you are initiating it at a bare level, but when it grows, I think it will
come. It has to come. It will come, and because full-time jobs will come in this, full-time trainers and that. We are expecting to reach a situation where Manipur becomes the hub where we have a training center, as in Kerala. Kerala, the one that is there is a WHO recognized center. Outside of US and UK, that is the first
Please do it at Finding the Voices.